Introduction to Gallbladder Health. The human body, a marvel of intricate systems working in concert, often communicates its ailments through clear and unmistakable signals. A sharp pain, a persistent cough, a sudden fever. These are the body's way of raising red flags, prompting us to seek attention and care. However, not all bodily distress manifests so overtly. Sometimes the whispers of dysfunction are soft, easily missed, or attributed to less significant causes. The gallbladder, a small but vital organ nestled beneath the liver, is a prime example. When this unsung hero of digestion encounters trouble, its cries for help can be surprisingly subtle, often masked by seemingly unrelated discomforts. Recognizing these silent signals is crucial for early detection and timely intervention, potentially preventing more serious complications down the line. Understanding the gallbladder's role is crucial for recognizing its subtle signals. To truly understand these subtle cues, we must first appreciate the gallbladder's role. This pear-shaped organ, roughly the size of a small egg, acts as a reservoir for bile, a digestive fluid produced by the liver. Bile, rich in bile acids, cholesterol, and bilirubin, plays a critical role in the breakdown and absorption of fats in the small intestine. After a meal, particularly one high in fat, the gallbladder contracts, releasing stored bile through the bile ducts into the duodenum, the first part of the small intestine. This efficient delivery of bile is essential for proper digestion and the absorption of fat-soluble vitamins like A, D, E, and K. Now let's talk about gallstones and their impact. Gallstones are hardened deposits that form in the gallbladder, and they can be quite troublesome. Problems arise when the delicate balance within the gallbladder is disrupted. Gallstones, hardened deposits of cholesterol or bilirubin, are the most common culprits. These stones can range in size from a grain of sand to a golf ball and may not cause any symptoms for years. Hence the term silent gallstones. However, if a gallstone obstructs the flow of bile in the cystic duct, the tube leading out of the gallbladder, or the common bile duct, which carries bile from the liver and gallbladder to the small intestine, a cascade of issues can ensue. Classic and subtle symptoms of gallbladder issues can be quite varied. While some people experience intense pain, others might have more muted signs that are easy to overlook. The classic symptom of a gallbladder issue is a sudden, intense pain in the upper right abdomen, often radiating to the back or right shoulder blade. This biliary colic typically occurs after a fatty meal and can last from minutes to several hours. However, the gallbladder's distress signals are not always this dramatic. Many individuals experience more insidious symptoms that they might not immediately connect to this small digestive organ. One of the earliest and often overlooked signs is persistent digestive discomfort after meals, particularly those high in fat. This can manifest as bloating, excessive gas, a feeling of fullness or mild nausea. Digestive discomfort and changes in bowel habits can be subtle indicators of gallbladder issues. Because the gallbladder is struggling to release sufficient bile to emulsify fats, the digestive process becomes less efficient, leading to these vague but persistent symptoms. Individuals might attribute this discomfort to simply eating rich food or developing a sensitivity, without considering the underlying role of the gallbladder. Another subtle signal can be changes in bowel habits. While more pronounced blockages can lead to pale or clay-colored stools due to a lack of bile pigment and dark urine, as the liver tries to excrete excess bilirubin, more subtle gallbladder issues can contribute to chronic, unexplained diarrhea or changes in stool consistency. Frequent indigestion or heartburn, even in individuals who don't typically experience these issues, can also be a clue. While these symptoms are often associated with stomach acid problems, they can also arise from the backup of bile or the inefficient breakdown of fats, leading to increased acid reflux. The sensation of fullness and discomfort in the upper abdomen can easily be mistaken for typical indigestion. Interestingly, pain associated with gallbladder issues doesn't always stay confined to the upper right abdomen. Some individuals may experience unexplained pain in the right shoulder or between the shoulder blades. This referred pain occurs because the nerves supplying the gallbladder share pathways with nerves in these areas, leading to a sensation of pain in a seemingly unrelated location. Frequent indigestion or heartburn, even in individuals who don't typically experience these issues, can also be a clue. While these symptoms are often associated with stomach acid problems, they can also arise from the backup of bile or the inefficient breakdown of fats, leading to increased acid reflux. The sensation of fullness and discomfort in the upper abdomen can easily be mistaken for typical indigestion. Interestingly, pain associated with gallbladder issues doesn't always stay confined to the upper right abdomen. Some individuals may experience unexplained pain in the right shoulder or between the shoulder blades. This referred pain occurs because the nerves supplying the gallbladder share pathways with nerves in these areas, leading to a sensation of pain in a seemingly unrelated location. Subtle symptoms and risk factors can sometimes go unnoticed. It's important to be aware of these subtle signs to catch any potential issues early on. More subtle still are unexplained nausea or a general feeling of malaise and fatigue, particularly after eating fatty foods. The body working harder to digest fats without adequate bile can lead to a feeling of sluggishness and mild nausea that doesn't necessarily progress to vomiting. Similarly, a sudden loss of appetite or a feeling of being full after eating only a small amount can also be a subtle indicator of gallbladder dysfunction. In some cases, gallbladder problems can even manifest as unexplained itching. This occurs due to the buildup of bilirubin in the blood when bile flow is obstructed, while jaundice, or yellowing of the skin and eyes, is a more obvious sign of bilirubin buildup. Milder elevations can cause itching without noticeable yellowing, especially in the early stages. It is crucial to understand that these silent signals, when occurring in isolation, might not immediately point to a gallbladder issue. However, the presence of multiple of these subtle symptoms, particularly in individuals with risk factors for gallstones, such as being female, over 40, overweight, or obese, having a family history of gallstones, or experiencing rapid weight loss, should raise suspicion. The history of understanding gallbladder ailments has evolved significantly. Ancient physicians recognized the presence of stones in the biliary system, but the precise function of the gallbladder and the mechanisms of gallstone formation were elucidated much later. In the 18th and 19th centuries, advancements in anatomy and pathology provided a clearer picture of the gallbladder's role in digestion and the consequences of its dysfunction. The development of imaging techniques like ultrasound in the latter half of the 20th century revolutionized the diagnosis of gallstones and gallbladder disease, allowing for earlier and more accurate detection. The current state of understanding emphasizes the spectrum of gallbladder disease, from asymptomatic gallstones to severe complications like cholecystitis, which is inflammation of the gallbladder, cholangitis, which is an infection of the bile ducts, and pancreatitis, which is inflammation of the pancreas. Medical research continues to explore the various factors contributing to gallstone formation, including genetics, diet, and gallbladder motility. From a practical standpoint, recognizing these silent signals can prompt individuals to seek medical evaluation. A healthcare provider can then conduct a thorough assessment, including a physical examination and potentially ordering diagnostic tests, such as an abdominal ultrasound, which is the most common and effective imaging technique for visualizing gallstones. Blood tests can also help assess liver function and identify signs of inflammation or infection. The implications of ignoring these subtle signs can be significant. Untreated gallbladder problems can lead to acute attacks of biliary colic, which can be debilitating. More seriously, persistent blockages can lead to the aforementioned complications of cholecystitis, cholangitis, and pancreatitis, all of which can require hospitalization and, in some cases, emergency intervention. The future of gallbladder health management lies in a combination of early detection, lifestyle modifications, and appropriate treatment strategies. While surgery, also known as cholecystectomy or gallbladder removal, remains the definitive treatment for symptomatic gallstones and related complications, ongoing research is exploring non-surgical options for certain individuals, such as medications to dissolve small cholesterol stones. However, these medications are not always effective, and gallstones often recur after treatment is stopped. Lifestyle changes, particularly maintaining a healthy weight and avoiding rapid weight loss, can play a role in preventing gallstone formation. A balanced diet that is not excessively high in fat may also help reduce the burden on the gallbladder. However, it's important to note that dietary changes alone may not be sufficient to prevent or resolve gallstones in all individuals. In conclusion, while the gallbladder may often work silently in the background of our digestive processes, its distress signals, though sometimes subtle, are important to recognize. Persistent digestive discomfort after fatty meals, changes in bowel habits, frequent indigestion, unexplained pain in the shoulder or back, nausea, fatigue, loss of appetite, and even unexplained itching can be whispers of a gallbladder in trouble. Paying attention to these seemingly minor cues and seeking timely medical evaluation can lead to earlier diagnosis and intervention, potentially preventing more serious complications and ensuring the continued smooth operation of our intricate digestive system. The key lies in being attuned to our bodies and recognizing that even the quietest signals can hold valuable information about our health. In conclusion, while the gallbladder may often work silently in the background of our digestive processes, its distress signals, though sometimes subtle, are important to recognize. Persistent digestive discomfort after fatty meals, changes in bowel habits, frequent indigestion, unexplained pain in the shoulder or back, nausea, fatigue, loss of appetite, and even unexplained itching can be whispers of a gallbladder in trouble. Paying attention to these seemingly minor cues and seeking timely medical evaluation can lead to earlier diagnosis and intervention, potentially preventing more serious complications and ensuring the continued smooth operation of our intricate digestive system. The key lies in being attuned to our bodies and recognizing that even the quietest signals can hold valuable information about our health.